And welcome to Healthy Hearts session. Welcome. I'm today's coordinator, Elizabeth. Today we have a lot in store for you. And today we will be focusing on kidneys and how our kidneys operate. So today we'll be joined by our nutritionists and dietitians, both Dr. Hiba and Dr. Alice, which will be on the call. And so without further ado, I'm going to hand over to our nutritionists and dietitians, both Dr. Alice and Dr. Hiba. Over to you, Dr. Alice.
Good evening, everybody. It's nice to be here again. And I'm just going to share my slides. And today we'll be talking about the kidney. So it's Dr. John together with Dr. Araba, Sahara Nutrition. And today's topic is about your kidney. So what do you know about your kidney? I would just like to know just something you know about your kidney. Maybe I'll start with Dr. Araba. What do you know about the kidney?
Helps with the control of water, helps with, that's one. Let's get other fluids.
Yeah, Elizabeth?
Helps with fluids. It's near your urinary system.
Yeah, thank you. And Susie, would you like to say something about the kidney?
Yeah, your kidney is important for flushing out a lot of things that are not good for your body. So that's the reason why a lot of people have to dialyze if their own kidneys aren't working. Yeah,
that's wonderful. Thank you so much for your contribution. So the first thing that you need to know about managing your health is having information about things, your organs, nutrition, and what you need to do about them. So today we'll be talking about kidney, not too much nutrition, but some nutrition, just really healthy information. So this is how your kidney looks like. This is the external view. This is how it looks like when you look at it externally. And this is the internal view. It has so many sections, it's unbelievable. And it is located in either side of your spine, and the kidney is a very small organ. So I'll ask you again, I don't know if you know this, but what is the weight of your kidney? Do you have an idea how big or how large it is?
Is it very small?
Thank you. Hiba, did you want to say something? Hiba? No, good. So kidney is very small, but how small it is. Sometimes when I talk to people, they're actually shocked at how small the kidney is. So the kidney is actually between 125 to 175 grams in males and about 115 to 155 in females. So 100 grams, an egg is 60 grams. So 2 eggs is 120 grams. So put that together. That's actually the size of the kidney, an average size of the kidney. So it's actually something very small. It's just the size of your wrist, like this, put together. So, and of course, males always have the bigger one. And it's really just about between 11 to 14 centimeters in length, 6 centimeters in width, and it is 4 centimeters thick. So you can take those dimensions, then you can actually be able to draw the side of your kidney and then comprehend it. So that's how it's looked like. So the kidneys are they're protected by the fats, the muscles, and the ribs of the back. So it's good to have a little fat. We shouldn't be too skinny. And it's good to have muscles. But remember, if you don't do some physical exercises, your muscles actually become like paper. They become like paper, like very loose like that. But if you exercise, then it becomes tight and toned. And then it can be very protective of other organs and not just the kidney. So, wonders of the kidney. So this is something that is called the nephron. And the nephron is it is found in large numbers in the kidney, like 1.3 billion per kidney. Remember, you have 2 kidneys, so it's 1.3 million. Remember, this is a small organ, 120 120 grams in average, but it has got 1.3 million nephrons. What do nephrons do? Nephrons have got two main parts, the tubules and the corpuscles. And the tubules, they're the ones that actually, they are the ones that regulate the passage of various chemicals in the blood. So we're just going to talk about that shortly. So can you imagine that this organ is got like 1.3 million of it in your kidney? So the kidney is complex. There's a lot that the kidney does. So it's really, I mean, all the organs are major. Your heart is major, your liver is major, the kidney is major. But now we're talking about the kidney. So let's just say it's one of the most important organs of the body. So what are some of the functions of the kidney? You mentioned one or two, it flushes out the toxins. So first of all, let's say it releases the hormones that regulate the blood pressure. You must just, the way we are created, you must just have the right blood pressure. The blood has to be, the blood has to be circulated through the body. So there is blood getting in and into the heart to be circulated, and there's blood getting out of the heart so that it can go and be cleaned. So the kidney is responsible for regulating blood pressure. So when you have high blood pressure, it means that your kidney has a problem, or your kidney is at risk of getting into serious trouble. So that's number one. Number two, it produces an active form of vitamin D that promotes healthy bones. So you know that vitamin D, you have to be hit by the sun, and then the sun together reacts with this, with an active form of vitamin D that is produced by the kidney, and that's how your bones are strengthened, or the utilization of vitamin D is complete. Your kidney is actually responsible for the production of this active form of vitamin D. And then it controls the production of red blood cells. You know the functions of red blood cells. Very important for your normal being. And that's not it. And I'm just mentioning just 6 functions of the kidney. It balances the body fluids. So if the kidney is not excreting fluid, then you find that you have a swollen face, or you have a swollen body, or you have what we call edema. And that can be very, very dangerous. When you're not flushing out fluids, like Liz and Susie says, then you have to see a doctor, because then the problem is with your kidney. What's the other function of the kidney? Is to remove drugs from the body. Most of the time, especially if you're taking chronic drugs or even painkillers, you get a prescription, it says, take with a lot of water. Most of the drugs have to be taken with a lot of water. Remember, these are not natural things. It's not food that you pluck out of the trees. It's not the fruit. It is man-made things, and they have toxin, they have waste material that must be excreted from your body. And this excretion is actually done by the kidney. So we have to make sure that when we take drugs, we follow the instructions that have been provided by the pharmacist. But we're going to talk more about this just now. Then we have to, one of the other functions is to remove waste products from the body. So when you eat, for example, let's take protein. Your body digests the proteins, but then we have what we call the nitrogenous waste. This nitrogenous waste has to be excreted off the body by the kidney. Any waste materials, when you take salt, too much of it has to be excreted by the kidney. Whatever you take, any excess of it must be excreted, and also whatever is toxic also has to be excreted. So that is the function of the kidney. It removes the waste products. And this is extremely important, because when your body is sick, it is these waste products that will actually harm you, because now the body is not able to eliminate them because the kidney is sick. So how do we care for our kidneys? How do we make sure that we constantly care for our kidney? So we should actually have fluid intake. Your fluid intake should be normal or higher. We have talked, last week we talked about water. You need to take about 1.5 to 2 liters of water. We can send you the calculations, and that means, and most adults of an average weight, maybe 60 kilos, should take between 1.5 to 2 liters. That is 8 glasses of water a day, because the kidney actually needs water to excrete. So you need to take water. If you sit in a heated room or a room with air conditioning and lighting, you need another 500 ml of water. So that means you need another 2 extra glasses. So you need to take like 10 glasses of water. If you run and exercise vigorously, for every hour that you're running or working out, you need to take 500 ml of water. And then we have your protein intake. So when you take protein, your meats and your vegetable protein, you actually produce what's called the nitrogenous waste. Nitrogenous waste is especially dangerous, especially when it's in excess, because it scars your kidney. You get kidney scarring. And especially if you're taking excess of the processed meats or processed proteins, your sausages, your bacon, your salamis, all those very highly salted protein. This produce higher level of nitrogenous waste, and this nitrogenous waste, it scars your kidney. So when your kidney has a scar, it means it will not function efficiently. And when the kidney is not functioning efficiently, it affects so many things, including your blood pressure. So your kidney does not function well, it has a scar, your blood pressure increases. So the protein scars the kidney, and when the kidney is affected, it also affects your blood pressure. When your blood pressure is high and it's not controlled, then it also scars your kidney. So then we have what we call a vicious circle of kidney damage, because high nitrogenous waste from your protein intake, from excess protein plus processed proteins increases, damages your kidney. So we need to make sure that we just take sufficient or recommended levels of protein. Really more vegetables in our diet and not too much protein. And some people always go on to these diets of high protein. They can actually be very dangerous. If you go on this high protein diet, sometimes you're told 14 days. And the reason they work for just few days is because most of these diets are actually done in a hospitalized patient, and then they're put on high protein intake for just a few days, 14 days. But you find that people can go into this high protein diet so that all they're taking is just protein. For 3 months, 6 months, they're just doing this. Very, very dangerous in the long run. Please always make sure that before you get onto a diet program, talk to a dietitian, get your tests done, and then get to know what is the right thing to do for your weight loss if you want to go into the weight loss. But don't do these drastic diets. They can be very dangerous. So to care for your kidney, we just need to take normal dietary intake to manage your immune system. We know that some of the things that can cause kidney dysfunction is urinary tract infections. If you don't go to pee, sometimes you need to go and pee, you need to go to the bathroom and you don't go and pee, you keep holding your urine, you get urinary tract infections. If your immune system is low, that urinary tract infections can actually get to your kidneys and you can get a kidney infection. Sometimes you can actually get an acute kidney infection and you can land in hospital. So please make sure you're always eating to have a good immune system. That's your fruits and vegetables. To have better repair and maintenance, just a balanced protein from animals and from vegetables. Growth and maintenance, eating a variety of foods, and make sure you get good rest, exercise, and physical activity to maintain a healthy kidney function. So how to damage your kidneys? Self-medication. A lot of us, I know, we just self-medicate. You have a headache, you go. In some countries, it's easy to get medication. In some other countries, it's very good that their pharmacists don't just allow you to take medication, or there are rules that prevent you from taking self-medication, which is very good. But some other places you go, you can take anything you want. You want a painkiller, you get it. You want an antibiotic, you take it. So when you take a lot of medication, sometimes it's self-medication when you prescribe for yourself, you will actually, it can damage your kidneys, because most of the time when you do this self-medication, you're not taking them properly. Maybe you have frequent headaches. This frequent headaches is underlying problem of something else. So why don't we find out what the underlying problem is? But most of us will just go and take painkillers to take care of the headache. Or you have some body pains, you go and take something else. So don't self-medicate. Very, very dangerous in the long run. The other way to damage your kidney is taking drugs, not taking drugs as instructed. If you're on chronic medication, blood pressure, diabetes, kidney problem, cancer, whatever it is that you're taking long-term, most of the drugs have waste, and this waste have to be eliminated by the kidney. And so if you don't take enough fluid, most of the time they say take plenty of water, take with food, take on an empty stomach. These instructions also are very important for kidney function. So follow the instructions. Sometimes most of the people actually, when you take maybe from 3 to 5 drugs, you end up being sick because of the side effects of the drugs. So you should manage that very well. Overuse of micronutrient supplements. You see, supplements like minerals, like zinc, calcium, magnesium, should really be prescribed for you by a health professional. So if we just go taking this, you'll find that you're taking 3, 4 vitamins in one sitting, especially the minerals. Those are usually more dangerous than just the vitamin A, B. So you can actually get into trouble with your kidney by just taking that. So don't take too many medications. Don't self-prescribe. If you are on chronic medication, please ask the doctor, how should I take this medicine? They need to give you instructions. Some tell you take it with a lot of water, take it on an empty stomach, take it with food so that extraction is easier. So just do that. So of course, the other way to damage your kidney is dehydration. Just don't take water. In fact, there's some time back I read an article that was very interesting, and it talked about when you don't take water and you're dehydrated, the kidney actually cannot perform its function. It cannot eliminate the toxic waste. So what does it do? It actually gets the liver to help in this process of eliminating toxins. And so your kidney can't work, so the liver works. And the liver is supposed to regulate fat, produce hormones, and do other things. So it actually stops its normal function to be able to eliminate toxins from the body in aid of the kidney. And then that also causes problems. You'll find that you have very high cholesterol, and studies have shown that people who are dehydrated actually have high cholesterol. So watch out, my friends. Let's make sure that we are meeting our water intake so we do not get our kidney problem. Diabetes, if it's not controlled, can cause kidney problems. So if you're diabetic, we want to know our numbers. We want to know what our HbA1c is. We want to know what our fasting blood sugar is, 1 after meal, 2 hours after meal. We want to know the numbers so that we can prevent these complications, because diabetes is a condition that you can live and die of old age, but when it is not controlled, then it can really be damaging to your organs and not just the kidney. High blood pressure. Remember what I said earlier? The kidney helps to control your blood pressure. If your blood pressure is high and it is not controlled, it damages your kidney, it scars it. Then when the kidney is damaged further, your blood pressure is very high. So it becomes a vicious circle. So also for people who have blood pressure on treatment, know your numbers. A normal blood pressure, if you're on medication for high blood pressure, your blood pressure should be about 130/80 anytime you take it. If you don't take blood pressure medications, should be always between 130/80 and lower 110/70. So the trick is here, know your numbers. Always know your numbers, what's healthy and what's not healthy. And of course, if you're obese and overweight, then the risk of damaging your kidneys are also high. But all these conditions can be controlled. All these conditions can be managed. And most of all, they can be managed by your diet. So just remember, you are wonderfully made. Please care for yourself. Food is thy medicine, and thy medicine is thy food. Thank you very much. I will take questions now.
Thank you, Alice. I was just checking to see if Elizabeth was taking the questions. If not, I'll just ask. Should I go ahead with the questions?
Yes, please.
All right. We have a few in the chat box. So the first one says, do we need water or fluid, since fluids contain water?
Very good question. I think we discussed that last time, but you can discuss it again. So you need water. You need water. Yes, the whole body needs fluid, but the best fluid to take is actually water, because the water has many functions, like we saw last time. Controls the body temperature, it lubricates your joints and organs, and it's got various functions. So when you take juice, like I was just taking ginger, this is ginger, the body has to still eliminate the solid from the solvent. It has to eliminate the ginger and separate the ginger and the water so that you get the water, and then is when the body can get the water, which is a lot of work. So yes, you can have your juices if you want, you can take your tea, but you need to take quality water. So when I talk about 1.5 to 2 liters, I mean quality water. No added lemon, no added piece of mango, nothing, just plain pure water. It will save you a lot.
I like the emphasis. The emphasis you place on the pure water, just water and nothing else. If you want to take juice once in a while, please remember here in the UK, it is just 200 milligrams. Is that correct? Milliliters. The glass, is that ml? Yeah, 200 ml maximum for a day. But that doesn't count as the water Dr. Alice is talking about. Now, another question says...
Remember, Hiba, that's 200 ml of juice comes with about 8 teaspoons of sugar. So it's dangerous for you. So for you to eliminate that sugar, you need the kidney. And for your kidney to be functioning well, you just must take good water, my friends.
Yes.
Yeah, thank you.
Thanks for the reminder. So there's another question that says, can we have healthy kidneys on a mainly vegan diet?
Say that again.
Can we have healthy kidneys on a mainly, if we decide to go on a vegan diet? Just vegan. Yeah.
Yeah. Okay. Vegan diet is really a healthy diet. And it's been shown, because if you watch some documentaries on animal health, they are injected with stabilizers, steroids, antibiotics, and this gets into our food systems. And so sometimes when you eat the meat, the chicken, or the fish, they are not naturally healthy. They're not like the way you get them into the sea. So then it becomes dangerous to eat the animal protein. And some people have resorted to it being vegan, and vegan is very healthy. So it's healthy. You can have a healthy kidney on a vegan diet. But one thing I found about with my vegan friends or vegan clients is they also take too much fat in their diet and too many spices in their diet, which now becomes a problem. So in short, if you are doing the right thing with your vegan diet, you'll have a healthy kidney, including all the other things that you have to do, like taking water, exercising, and resting.
Yeah, thank you for clarifying that. A lot of people sometimes think that, once you just go on plant diets, you are eating healthy, but it is not the case. You can just focus on plant diets. Yes, I think someone wants to say something. Sissy, did you want to say something? Or are you a culprit?
I think that's a really good point. I think one of the things I've learned about I'm not a total vegan, but I mainly eat vegan diet, is making sure, as you said, you're not actually having processed vegan supplements. Once in a while maybe, but not like if somebody's having 7 days a week processed vegan information. A lot of them have got they've got things in it that have got a lot of spices in them, or things that are quite heavy carbon, that are very heavy kind of food. So trying to make sure that you eat clean means as much as possible. Try to eat the vegetables in the cleanest form. It's not being a purist. It's about balance. It's about balance. You're saying, over my last 7 days, what did I eat? And do I need to kind of balance out that little bit of vegan sausage with maybe having lots of sort of like other steamed vegetables.
Yeah.
Mm-hmm. Yeah, very good. And I watched a documentary on processed vegan, like processed vegan burger, and it was really scary. So thanks for bringing that up, Susie. So even vegans, we have a lot of processed foods. So are you eating vegan processed, or are you eating vegan? Yeah. So let's eat healthy and let's balance. Sometimes I like to eat a sausage once in a while, but how often is that? You know, once in a while is okay. Every week, every day, not good at all. So yeah, thank you.
I'm conscious of time, but there's just one more question. What size of protein do we need a day?
Mm-hmm. Are you sure you want me to prescribe protein for you? I will ask, what is your source? I will ask you so many questions before I prescribe your protein. But deep down, everybody has accurate nutrition information. I will avoid prescribing a protein because I don't know what your weight is. I don't know what your needs is. But the first thing I always ask, what is your source of protein? Is it processed? It is natural? And how much are you eating in a week? And then with that, we can actually make a decision. So I'm afraid I will not prescribe, but you obviously know how much you need to have. So maybe another topic for another day.
Yeah. And when we start having the tailored sessions, we are going to then start prescribing, or if that's the right word, you know, we take some information from you, so we'll be able to suggest how much you should have daily or in a week. So I'm going to hand over to Elizabeth. Thank you so much for engaging. Thank you, Dr. Alice, for another very good session.
You're welcome. Thank you for your contributions. Thank you very much.
For you.
Oh, thank you. Thank you very much.